Amidst the vibrancy of urban existence, there exists a parallel reality often overlooked: the silent struggle of refugees amidst the flow of everyday life. As city streets bustle with activity and commerce, there are individuals silently grappling with the challenges of displacement and upheaval.
In today's world, millions of refugees are seeking sanctuary from conflict, persecution, and natural disasters. But even as they find safety in new communities, they face another challenge: access to quality healthcare services.
Many refugees come from regions torn apart by war and disaster, where healthcare infrastructure is often non existent or severely compromised. Upon arrival in a new country, they encounter language barriers, cultural differences, and bureaucratic hurdles that further impede their access to care.
So within Malaysia, access to healthcare is limited because it's quite unaffordable, and they pay 50% of what foreigners will pay in the public hospitals. That would be many, many times more what Malaysians would be paying. Of course, Malaysians enjoy a highly subsidized healthcare in public hospitals. So for refugees, they will be paying half of what other foreigners would pay. For example, if they have to go for admission, they might have to pay 1,004 to 2,008 deposit upfront. So that really prevents them from accessing some of the very needed healthcare. However, having said that, a lot of them still go to public hospitals, and they may be depending on communities around them. They might borrow money, etc., to fund admission to the hospitals. With regards to social issues, of course, there are a lot of social issues as any community would have, any population would have. There are child protection issues, there are gender-based violence issues, there are day-to-day issues of trying to make a living in an environment where they are not allowed to have formal livelihoods in Malaysia. So they have to work in the informal sector and sometimes are exploited by employers in that sense. So a lot of the work we do is also trying to advocate to the government to allow refugees to work formally. I guess understanding the situation is important. Why there are refugees, who are refugees, how are they different from migrants? I think if everybody understood that, and also look at how they can support their, in whatever small way they can, but even just speaking about the situation for refugees in Malaysia to others who do not know about it, and to ensure that people have a better understanding and is able to be more compassionate when they listen to issues about refugees in Malaysia, which is unfortunately driving a very negative narrative. Particularly, a lot of hate and discrimination is happening now, targeted towards Rohingya refugees who have faced basically genocide in their country. So this is something just disheartening to see. So every person could do their part in understanding the situation and finding out facts rather than listening to what's going on social media and believing what they hear on social media country. And hence, behaviors and reaction needs to be understood also from the perspective of what the population or people in your age group can also do something like, helping refugees understand what is it like to live in Malaysia, what are all the cultures about, what are the laws of Malaysia about, maybe do your own little, now everybody's going on social media, use social media for positive messaging, to encourage more compassion for people like them, because we are all very privileged. We have not had to go through the kind of experiences I just mentioned. So if you walk in those shoes, what would you like to say to them? Just to also drive a thought of compassion among Malaysians for people who are living among us as refugees. They may come from various backgrounds. I have doctors here who work as immigrants, because they're doctors in their own country, but overnight conflict, they've lost everything. And they come here, they don't have a legal status, they have to work like any other migrant labor here. So that's when you start walking in the shoes of the other, you understand what they've been through.
However, there are organizations and healthcare providers working exhaustingly to bridge this gap. Community health centers and NGOs collaborate to offer culturally sensitive care and interpretation services, ensuring refugees felt welcome and understood.
Education plays a vital role in improving health outcomes. Workshops on topics like nutrition, hygiene, preventive care, and mental health empower refugees to take charge of their health and well-being. These workshops serve as invaluable platforms for disseminating essential information, fostering a deeper understanding of health-related concepts, and equipping refugees with practical skills to navigate their health journeys effectively. By addressing topics such as nutrition, refugees learn about balanced diets, food choices, and the importance of essential nutrients. Hygiene workshops emphasize proper sanitation practices, such as hand washing and sanitation of living spaces, to prevent the spread of diseases. Additionally, mental health education provides strategies to cope with the psychological challenges often associated with displacement and uncertainty.
Despite the challenges, progress is being made. By fostering collaboration, empathy, and understanding, we can ensure that every member of our community, regardless of their background, has access to the quality healthcare they deserve. Through collaborative efforts, healthcare providers and organizations strive to create inclusive environments where refugees feel supported and valued. By offering culturally sensitive care, interpretation services, and comprehensive support systems, we can break down the barriers and ensure that the refugees receive the healthcare they need and deserve.
In addition to raising awareness through our video, our team also took action by fundraising to support the healthcare of refugees. We donated 100% of our proceeds to 7 organizations dedicated to this cause, contributing directly to improving the lives of refugees in need. The donation was made to support the vital work of providing healthcare services to refugees. Although modest, we know that our contribution will help alleviate some of the challenges faced by refugee communities. Improving access to quality healthcare services for refugees is not just a moral imperative, but also a testament to our values as a compassionate and inclusive society. By taking concrete steps to address the barriers faced by refugees in accessing healthcare, we can make a meaningful difference in their lives and uphold the dignity and rights of all individuals, regardless of their background or circumstances. Let us come together as a community to ensure that healthcare remains a fundamental human right for everyone, including the most vulnerable among us.